Welcome. This is for professionals who want to know a little bit more about the Christian Wholeness Framework. I'm Dr. John Warlow, psychiatrist and founder of the Christian Wholeness Framework, part of the Living Wholeness community, and here with Andy Pocock. Andy, do you want to introduce yourself?
Hi John, yeah, I'm a counsellor, private practice, and work in Brisbane.
Great. And so we've mentioned already that the Christian Wholeness Framework is for a range of professionals in terms of experience and also discipline as well, and how that the Living Wholeness the Christian Wholeness Framework can actually help personally, but also professionally. And just wanted to go into that in a little bit more detail, particularly in terms of looking at skills and knowledge, especially, I think, Andy, looking at the question as most professionals have already got the tools of the trade. They've got the language, and why even know more? What has the Christian Wholeness Framework got to offer them?
Well, if I could just say what it's done for me. I got my master's in counselling, and so I learnt all the different models and everything. But the framework gives me a very clear map of where to go and how to go and where things fit together. So, for example, just starting with a client, the cure model, which is part of the framework, I do that every day. I do that with every client. I do that in every conversation I have. So it doesn't take away from any other model. It just adds to it. Gives me this deep DNA, I guess, of my practice is curing and safety with each and every client that I deal with. And then it goes from there with the different things. One of the things you developed was this circle, and it just helps me understand the whole person. Before that, I sort of had bits and pieces of a person, understanding them. Now I can systematically see the different components of a person and understand them at a much deeper level.
I think, Andy, you're right, and certainly for myself, the steps, the cure steps and the circles are what I use most of the time. And the cure steps, in fact, come from the approach, which we take in medicine and psychiatry, and also psychology, which is to have that alliance first, just that connection, then to get an understanding, or if you want, an assessment, and then to move on to the actual therapy side of things, which is the response, the connection, the understanding, the response, and then to refer to others, which is engage other help. Finally, we actually put the little E on the end of the cure E, if you want, which is the evaluate, to keep an eye on how we're going. Yeah. And the circles, I'm just using, every patient I see, I do a picture of the circles so I can see them in a comprehensive way. It's like it provides the mental state examination for the patient in pictorial form. And firstly, it allows me then not just only to see what the problems are, but also then what a pattern recognition in terms of diagnostics are for people, for example, with depression or with psychosis, or in fact with relational issues, being an adult child and family psychiatrist, to actually put both of those people, and indeed the person of the, as it were, of the relationship, one can embody in the circles. And finally, I think, is to look at, well, what are the targets to actually focus in on in terms of change, which actually thus allow me to incorporate a lot of models, a lot of tools, as it were, into this tool bag, and to put a lot of theories together, but much more cohesively, rather than even being eclectic, is to be holistic.
Yes, yeah. I think, obviously you're talking at a psychiatry level. As a counsellor, I'm not doing the same level of diagnosis. What the circle does for me, it helps me see where I haven't gone, helps me see what I'm missing. So very often, I'm personally drawn to the heart sector, identity, self-worth, control, all those things. But the circle makes me also realize that the whole thing of perception and thought and volition and mood, you can't just go to your favorite area. You've got to see the person as a whole. And I think that's what it does for me. It just balances it out so that I always see the whole person.
Yeah, I think you put it so well. And what I like about it is it's like a jigsaw piece puzzle template.
Yes.
So I can see the jigsaw pieces which are missing. And certainly in my experience as a supervisor, one of the big issues often is that people just haven't got all the relevant pieces together.
Exactly.
Either in the present or then to be able to look at the past and how the past links in with the present. In other words, to get a good etiology or a good causative view of what's happening, both in terms of not just negatives, but also positives. What have been the protective factors, which I find very helpful, for example, in a more of a narrative approach. And then moving on to the future, once I've got that template, then I can see much easier what's this jigsaw picture going to look like in the future. Takes the puzzle, if you want, out of the jigsaw puzzle and makes it more of a picture.
Absolutely.
Yeah.
And you can see where the areas that need to be focused on, you get them. Whereas without it, sometimes certain pieces of the puzzle just go missing.
I think, sorry Andy, I was interrupting. I think it's also not just good, I think, what we've talked about for connection in terms of especially being with a patient and client in the context of a relationship, having that attachment and attunement with the patient and client, just that sense of presence. Moving on then to the understanding step of being able to indeed get a greater perspective of what's going on, and then to be able to move on from there in terms of a response step, which, because these are steps, we're still continuing to have that alliance, we're still continuing to have that understanding. But then the response, for me, I find it's like a map, and I know where the main freeways are, I know where the distractions are, and where I might just get lost wandering around some kind of suburb, and where to get to, not just overall with a patient in terms of their therapy, whether it's psychotherapy and pharmacotherapy and so on, but also just indeed in every session where I see someone. And finally, for me, it also helps me to really keep in mind, I'm just so grateful for the shape of the pyramid, which obviously is talked about elsewhere in this website, but it's the whole thing of I'm not the be-all and end-all. I'm not the be-all and end-all. And to know that, hey, I'm not on a higher level than anyone else in terms of people helpers, the church, family and friends. I'm on the same level. We're just on different points of the line. And if the patient and client, if I can actually facilitate and they can actually engage with others, then the prognosis of the future is so much better. Andy?
John, obviously we're going to have to talk in detail about cure, because people don't really understand what we're saying, and the circles, the detail of it, and the pyramid. I mean, we've introduced three huge areas in a few minutes. I want to come back to the basics though. Coming back to that cure model, one of the things I think we as therapists do is we're so busy getting on to response that we lose connection with our client, and as soon as we lose connection, therapy goes out the window. And that's what the cure model has taught me, being able to progress from connection to understanding, getting to response, doing therapy, but when connection is lost, to go back to the ground floor, start all over again, and then maintain that therapeutic relationship throughout therapy. And that was hard for me to learn. And I think probably the best lesson, I'm not sure how I would have learned it without the cure, because just walking up the steps, and I remember walking down steps backwards just until I got it, because we all know that relationship is primary to everything.
Certainly in the particularly when I'm doing psychotherapy and something's going wrong in that session, well, indeed, for me, one of the first things I do is I think I've probably gone too far on the steps, and I've just got to walk on back downwards.
Just come back down.
Just as you're saying. Indeed. And I think that as the professionals are looking at this as well, it's that people if I could say, can come to someone, a professional who does Christian Holiness Framework, whether they have no faith, whether they have another faith, or indeed whether they are Christians. And but that's a whole other area, the issue of spirituality in this, as professional counsellors, for us to be able to be with someone, regardless of their gender, age, culture,
Absolutely.
And so on,
Yes.
and regardless of their beliefs,
Yes.
and to be able to stay with that person and help them. It is not an exclusive approach, while it does, on the other hand, hold very strongly to Christian approaches.
Certainly for me, I counsel everyone, and it doesn't exclude anything, and it's not prejudicial to someone who holds another faith, because the spirituality is just the deep core of who they are and what they believe. So it's not prejudicial in any way to me, and I'm able to counsel. I don't care what their orientation is sexually or their religious beliefs are. I found that the framework is applicable to everyone.
I think the framework is highly uniting and inclusive, while it does allow each practitioner, I found, to have their own personal views about particular things like sexual orientation and spirituality. And I think just like then it allows us to be with them, certainly from my point of view. I'm an active Christian, I've got my own views about sexual orientation and stuff. I'm not going to impose that onto anyone else. And they can come as they are,
yes.
On their walk through life, as well. I think not just with those aspects, and we'll talk more about those on the website as we go along, but also in terms of just looking at gender, age and culture. I'm an adult child and family psychiatrist. We do this work overseas, in Asia as well as here in Australia, and also relational, not just individuals, but with marriages, kids and families. It provides that capacity to be with a whole lot of people.
Absolutely.
Yeah. Great. So thanks for being part of this. And if you want to know more about how Christian Holiness Framework can be a benefit, look on the website and look forward to your being a part of this community. Thanks.
Thanks, John.
So thank you very much for joining us in this introduction for professionals, and hope that you can actually continue to be part of the community of living wholeness, and for you to be able to use the Christian Holiness Framework in a way which actually empowers you and releases you more, not just only in your work, but also, maybe more important than that, as you are a servant to others, to help them in their work, whether they be people helpers, churches, or just the everyday person, and also indeed your colleagues. Thanks again for joining us, and look forward to seeing you again on this website. Also, just to say that there will be full details on the cure and on the shapes, as you'll be able to see on the website, and I hope you're able to really use these for your advantage and to serve others.